We're back with another episode of a conversation about COVID with our panel, YPG Commander Colonel Patrick McFall, Command Sergeant Major Jamathon Nelson, Technical Director Larry Bracamonte, Deputy Garrison Manager Ron James, and Health Clinic OIC Major Jennifer Fiandt. Colonel McFall, do you have any opening remarks?
Mark, thank you. We're at HPCon Bravo, and that is an excellent thing, and it's all because of you. The amount of priority you put on safety to you and to our community, ensuring we protect each other, is shown. And I want to say thank you. We must remain vigilant and continue following the CDC guidelines as will be discussed by the panel further on. But as I stated in the last video, this video will further address HPCon Bravo from the post-leadership perspective and the questions you submitted.
Colonel McFall, we're heading deeper into autumn and winter visitors are starting to arrive into the Yuma area. What's going to happen at YPG if COVID numbers spike in the greater Yuma community? Are we going to go back to HPCon Charlie?
We will have to look at the restrictive measures we put in place. What those are, we'll look at them on an individual basis. Maybe it's a particular area that's causing it. I'm not sure. What I do know to date, most of our positive cases come from off-post. They're not originating from on-post. So that is a testament of what everybody is doing. And again, I always say thank you. But will we go from HPCon Bravo up to HPCon Charlie? If the situation dictates and we have to, yes, we will. It is upon our community to hold each other responsible and accountable as we still navigate through this COVID-19 environment. But again, thank you for everything you're doing. Thank you, Mark.
Mr. Bracamonte, some offices on post are returning to full strength, while others still have a certain portion of their workforce teleworking. Is that an inconsistent application of the telework policy? And just generally, how is going back to HPCon Bravo going to impact teleworking?
Mark, no, I do not believe it's inconsistent. We're monitoring the situation very, very closely, and we're allowing our subordinate supervisors to determine when they need to bring personnel back to work. Also, one thing to remember is not having the entire workforce in our building, minimizes the risk of spreading, the COVID virus. Also, HPCon Bravo will allow us more latitude to bring personnel back from telework, and our supervisors have been considerate with regards to child care and people with pre-existing conditions when making the determination to bring folks from telework. So again, like the commander says, YPG is doing a really, really solid job as far as, practicing the safety protocols. I will tell the people, of YPG, please keep up the good work because again, when it's all said and done, obviously we still have a mission to do.
Mr. James, as usual, the Child Development Center seems to be the garrison entity that gets the most inquiries from the workforce. How is the CDC handling the greater number of children coming in as people come back to work on post? And is there going to be another meeting in the near future about CDC developments for the parents there?
Yeah, so kind of two parts there. Before I answer, I do want to give out an extension because I will use that later on. So the Parent Central Services, extension 3339 is where you'll get information. So HPCon Charlie to Bravo, when we went to Bravo, we could increase capacity to 75% and allow non-mission essential personnel to bring their children in. We're not there. We still have excess capacity, so we haven't had a huge increase. So we're at about a little over 50% right now. But procedurally, nothing changes between Bravo and Charlie. Same precautions, same mask requirements, same cleaning requirements. We're still having care providers go out to the cars, get the children, and bring them back in the evening. So procedurally, at the CDC or CYS, nothing changes. The difference is a little bit more children in the CDC. So like I said, it's at about 51%. As far as the parents are concerned, every quarter we have a Parent Advisory Council. The next one is a week from today on the 20th at noon. And that's why I wanted to give that extension. So if you want to dial into that, 3339 is the extension you call to get the information to dial into that. And that happens every quarter. So if you have topics that you would like addressed at that council, call that number and let them know, or just come into the council and bring up your questions, concerns as you have them. But overall, we've had a lot of repetitions through this. Even when we were at Charlie, we had children in the CDC, so our care providers have gotten a lot of practice. They've got a few more children now, which does increase risk some. That's why we don't change our procedures. We keep everything the same.
Sergeant Major Nelson, during Project Convergence, all the personnel who directly supported the project were tested for COVID at least twice. Why isn't the health clinic testing the workforce like that on a regular basis?
So what we were trying to do is create a bubble, and that was part of the plan. When we were working the plan for Project Convergence, probably the biggest portion of it was the mitigation of COVID-19 as far as visitors coming in and visitors leaving. So we submitted that plan to the Army. It went all the way up to the Army G357, and they told us how we'd go about protecting the workforce and the visitors and keeping them separated from the general public on YPG. So with that, we were given funding and resources to do that testing. Testing isn't cheap, so we were given a contract, outside of Yuma, so we would do the tests and then the contract would send them off. When PC ended, that ended also. So a lot of it had to do with supplies and funding. That's the Army gave us the money to test for Project Convergence. We would like to, if we had the money, we'd like to do testing. We still don't have the means to test at the clinic. So that's why the tests were taken, the samples were taken, and they were taken to Phoenix, and then we would get the results from Phoenix.
Testing is only one part of a COVID mitigation strategy. You can't test your way out of COVID. No matter how many tests that you do in a community, there's always a lapse between potentially being exposed and infectious to when we can actually pick that up with a test. So that's why it's so important to continue with those common sense precautions, masking and social distancing, et cetera, because you can't just rely on the test. It's a crucial strategy, and it's a key part of what we continue to do, but it can't be the only thing that you rely on to mitigate COVID.
Major Fiandt, has the novel coronavirus been weakened or attenuated in any way since it was discovered earlier this year? Is it still important to keep wearing our face masks and do all the other anti-COVID mitigations we've been doing?
So I think it's absolutely essential that people continue with those common sense precautions that we've been doing since the start of the pandemic. Wearing a mask, social distancing. If you must be around other people, it's safest to do it in an outdoors environment. The virus has not weakened significantly. That's something that we tend to see when a virus has been around people for a long time. So that happens over years, decades, even longer. For example, the famous flu strain that everyone talks about, the 1918 flu, it didn't go away. It was around for a good 20 years and pretty common circulation, and then it sort of was weakened enough that it ended up combining with other flu viruses, and there are still parts of it that are in the seasonal flu today. So that's the sort of thing it tends to take a long period of time, not over the course of 1 year, unfortunately.
Do you feel it's important that folks get a flu shot?
Oh, absolutely. The flu shot's one of the best things you can do to protect yourself and protect your health. So just to dispel a myth, you can't catch the flu from a flu shot. Some people do feel a little ill or run down, and that's just from your immune system sort of reacting to the shot as it starts to recognize and build antibodies of its own. With the flu shot every year, they take the flu strains that they think are going to be the most worrisome, the most threatening, either in terms of how severe that flu strain is or how prevalent and how easily spread that it might be. And those are the strains that are included in the flu shot. And it's also good to note that, say you get your flu shot and you're protected against those strains, but oh goodness, you get another strain of the flu that wasn't included in the flu shot. It still does also give you protection against those other strains of flu. You might get sick, but you should have a shorter, lighter case of the flu than you might otherwise.
So what does life look like going forward? As I stated earlier, the mental fitness of all YPG is at the forefront of my mind. Opening activities, giving people things to do, allowing them to expand beyond their home, I think is important. I think it's important that we are allowed to do those type of things. But it's also important that we hold each other accountable. Because if we're not careful and we do not apply the CDC guidelines, the numbers can quickly spike. And then we have to start taking a look at what activities we might have to limit. I do not want to do that. This is important to me. Are we going to have a fall festival? Yes, we will. The team gave me a briefing, it was about a week ago, and it sounds like everything's in place. They're going to have a lot of safety in place. The clinic has been consulted. They're going to have all safety precautions. We're going to do a fall festival. The next Friday, we're going to have a movie night out on the Cox Field. And then Saturday, I'm dressing my kids up in Halloween costume, and we're going to go trick-or-treating. Now, we will have guidelines out there, okay? Those guidelines will be published. And I'm going to ask everybody to please, best you can, please adhere to those guidelines. It's to keep us, protect you and everyone out there. Thank you.
Colonel McFall, do you have any closing remarks?
You know, thank you, Mark. As I said, this video is really to expand upon HB-Con Bravo. And I want to open it up to the panel and ask you, what does HB-Con Bravo mean to you?
So when I think of HB-Con Bravo, I like to think of it as being a success not only for us as a clinic, as healthcare professionals, but also for the community. It means that we've been doing the right things and there is less COVID out there in the community to spread and potentially be infectious towards people. So I think it's wonderful. Obviously, this is going to be a long winter. We've got a lot of COVID ahead of us. So the way we stay at HB-Con Bravo is to continue to be vigilant, to continue to take those common sense measures to protect ourselves and our families and our community. And that's what I hope we continue to see going forward.
I also look at it a different way. It's not a time to drop your guard. Because, there's been some relaxation and some liberties, have opened back up. Dining in, it's still a time to remain vigilant, not get complacent, so we can maintain Bravo, hopefully go to Alpha, and not have things turn the other way. Nobody wants to go back to HB-Con Charlie.
Like everybody has said, we need to keep our guard up, because otherwise, if we don't, then the cases could trend upward, and perhaps we'll have to go to HB-Con Charlie again, and we definitely don't want to go there. So give yourselves a pat on the back. You're doing great things, continue to do them, and hopefully we can minimize the spread of COVID, not only in Yuma County, but across the United States and the world.
So going to HB-Con Bravo to me means more services available to the community. Still with those precautions in place, we still need to be careful, but it's a lot more fun working and living on YPG when you're able to go into Coyote Lanes or the Cactus or have trick or treat or have a fall fest. Again, we need to keep it safe, but it's just a lot better environment when we're able to offer the community some of those services.
I want to thank y'all. I appreciate y'all taking time to come out here and do these videos. I know we talk about this all the time. We're consistently talking about how do we maintain safety, how do we open things up, what can we do for our YPG family. And I know at forefront of everyone here, you're consistently saying to me, hey, what can we do but still be safe? So I want to say thank you to y'all, okay? And I want to say thank you to our YPG family. Safety is, you can see it every day. And I just want to say thank you. And my final question to you is, what does HB-Con Bravo mean to you? Have a good day.